We're seeing how COVID-19 is impacting so many of us. The Delta variant is causing significant problems, an explosion of cases in many states like Florida, Texas, Mississippi, Alabama, so many of these different states. In fact, we now are hearing and seeing more individuals who are getting COVID, even though they've been vaccinated, like Senator Lindsey Graham of South Carolina. Again, in Florida, as a result, people have been waiting in line for hours to get a shot because this Delta variant has really changed so much. In fact, Alabama's COVID positivity rate is now the highest in the nation. Texas has surpassed New York for the number of COVID-related deaths. And so, folks, this is causing problems. And so now we're trying to understand the CDC data that has come out that's saying that vaccinated people are spreading the virus. What does that even mean? Well, let's talk about this here with Dr. Joseph Graves. He is a professor of biological sciences, North Carolina A&T. Also, Dan Fagbuyi, a pediatric medicine specialist. So glad to have both of you here. So, Dr. Graves, can you please explain to us really what does this new CDC data mean? That people who are vaccinated are spreading COVID-19 or have that capacity? Makes sense for people who are confused because they thought people can say, well, we heard one thing from the CDC, now we're hearing something else. Explain what this really means.
Roland, thank you. Basically, the vaccines, for the most part, prevent people from coming down with COVID. So if the vaccine prevents, say, 95% of individuals who take it from coming down from COVID, that 95% are not going to be able to spread the virus. But that also means that the 5% of people who can get COVID who are vaccinated usually have milder cases, don't require hospitalization, and don't generally die from COVID. But that doesn't mean that a person who has been vaccinated, in that 5% who actually do come down with COVID, couldn't pass the virus along. Now, what we know about the Delta variant is that, in fact, it's more transmissible and generally makes people sicker. And also the effectiveness of the existing vaccines against the Delta variant has gone down, which means more people will actually, who are vaccinated, will actually get the Delta variant, even though that doesn't mean that they're going to be hospitalized or die from it. But that does mean that they can potentially pass it along, particularly to unvaccinated people.
To not unpack that, because again, explain to the audience, first of all, so the vaccine, like I took Moderna, okay? So the Moderna vaccine that I received was meant to ward off the initial COVID-19 virus, correct?
That is correct.
So what then happens is, viruses, as you told us last year, this is going to happen. Once viruses get within the human body, they begin to mutate and they create a different strain. So the vaccine that was created is not necessarily going to be as effective against the essentially new virus.
Yeah, and we know that the vaccines that were created against the initial strains are not as effective against the Delta variant. And again, as you pointed out to your listeners, I warned people of this over a year ago, that unless we brought down the number of infected people and did it rapidly, that there would be continuous evolution of new strains that would become more dangerous and more transmissible. And what we're seeing now from the data that's released from CDC and the Johns Hopkins Center, the states that are in the worst shape with regard to new COVID cases and hospitalizations and deaths are the states that voted for Donald Trump, that didn't believe, that had large numbers of people didn't believe that the COVID virus was serious, and large numbers of people who never got their vaccinations. And so now we are headed in a direction that none of us wanted to see. Everybody wanted to see the summer of 2021 as things going back to normal, but we're actually seeing the trends heading in the wrong direction. So if there's not national action soon to require vaccination, to require masks in school, to treat this as the public health emergency that it is, we are not going to get better. We're going to get worse. And there are more variants that are going to evolve coming down the pipeline. Some may be even worse than Delta. So this is not something we can fool around with.
So, Dr. Dan, we want to bring you in here. So there's so many people, to Dr. Gray's point there, that were hard-headed. There were so many people who were like, okay, I don't really want to trust this thing. We keep seeing these stories. There was a couple out of Houston, I believe, who both of them are on ventilators near death, and we wanted to wait a year, see how these things turn out, and now they basically are sending messages to their family, please make sure our kids get vaccinated, and folks just assumed that this was just going to be no big deal. Hey, I can easily get over it. Donald Trump, that was the position that he took, even when he was near death with it. He acted like, oh, this was great, this is wonderful, I got this great cure. No, but they threw everything in the world at it, and so he was the beneficiary of stuff a lot of us would not get. And so now, as a result, this thing is now, in essence, not contained. And once it goes basically outside of containment, you don't know where in the hell this is going to end up.
Yes, thanks, Roland, for having me. And so there are a couple of things. Let's make sure that it's totally clear for the audience. And I'll wear my biodefense background hat on this. Look, we have to understand what a vaccine actually does. Let's educate us one-on-one. Just because you graduated from the 12th grade and you got your biology and copied off somebody in your class does not make you a doctor, one. Two, no, it's really true. These are the things I'm fighting and having these discussions on misinformation, disinformation on different platforms. I want to make sure that's clear. A vaccine is not a force field, so it does not just block the virus and you don't get exposed. So I would liken it to maybe a training program, maybe like physical defense, a defense course, assault course, where you get training. That's what you're doing with the vaccine. It trains your immune system to be able to ward off the assailant, in this case, the virus. That's what people need to understand the message. So all these positive cases, I would also redefine that. The messaging has been messed up here. It's actually SARS-CoV-2, the infection. That's what they get when they have these positive tests. That doesn't mean you have COVID-19, the disease, where I have to put a tube down your throat in the emergency department or send you to the ICU and you're on potentially dying bed. That's the big difference. So yes, you will see these cases. I don't like using breakthrough, but that's the lingo that's out there. But understand the vaccine is not a force field. Second, important, our children are priority. Look at the cases. They have started to increase significantly. Children accounted for about 14.3% of the cases typically throughout this whole pandemic. In the past 2 weeks, that number ticked up to now about 19%. So now children are accounting for or have had an increase of maybe about 5%. Last week, about 10 days or so, maybe kids accounted for maybe 32,000 or 36,000 cases. You can look all this up on the American Academy of Pediatrics website, Children's Hospital Association, and CDC website. And then in the past 10 days, it's now increased 72,000 cases of SARS-CoV-2 are children. So the number is going up. You can see the trend, and I start to anticipate what those policies need to be, and definitely advocate for your children. So that's my beat. So I got it off my chest.
So I got to ask both of you this. Here's a perfect example. D.C. Mayor Muriel Bowser has come under a lot of criticism for issuing a mask mandate and then attending a wedding where no one was wearing masks, and then attending another birthday party. And so now we have this mandate saying that even if you're vaccinated, you should be wearing your mask indoors. Aren't people also kind of screwing this thing up, public officials, by saying one thing and then doing another? I mean, look, we're already fighting a massive disinformation campaign. We're fighting people who do not trust the government, who don't trust anything. To me, those are blunders that make no sense whatsoever. I mean, I'll give you a perfect example. After last week with the Delta variant, and then I saw what was happening with major corporations, I sent an email to my staff, maybe it was Saturday or even Sunday, saying, if you are not vaccinated, you cannot come into my office. You got 2 weeks to get vaccinated. And if you don't get vaccinated, you're not going to have a job. Now, some people may say that's too harsh, but the reality is I'm not trying to get sick. I'm not trying to get any of my staff sick. As an owner, I have to be cognizant of my staffers and what's going on with them.
Now, Roland, I completely agree with you that, there needs to be a consistent message, and the consistent message is mirrored by the way you behave in public. So if you're going to say that there needs to be a masking mandate, then you need to go around wearing your mask where it is appropriate to wear your mask. It's really that simple.
Yeah, I definitely think corporations have actually stepped up in this case, Roland. It's literally, as I said before, and I've said it on other outlets, that the corporations are actually leading the feds, and they're leading your local government officials in regards to the messaging. And that's because it's hitting them in the wallets. It's not altruistic. It really is mostly because it's hitting their pockets. And I would say the NFL, they actually stepped up. Now, the subsequent corporations have been following suit. We've heard Walmart, Disney, just as you said. So that's who's leading the charge. And I think that will actually bode well for us. But this whole masking thing, yes, the message has been mixed up, but the virus also has changed. So let's not get that twisted. Science is not necessarily the truth. As someone said, science is actually looking for the truth. So it will change, but we have to understand that it is a dynamic of change, and we have to do that. Some of my colleagues have said we shouldn't even be dangling the whole mask issue and just say, you know what, mask, do what you need to do, wash your hands, get your vaccine, and call it a day, and be clear with it. We've tried the other way. Some have argued that if aliens were supposed to invade us, we, with our civil liberties and lack of cooperation, lack of working in unison in one accord, will be our downfall. And I actually think that's actually right, sadly, but true.
Yeah, but I think the problem is deeper than that, because Americans confuse freedom with license. And they're not the same thing. You don't have the freedom to walk into a crowded movie theater and yell fire. That's license. So in the same way, with regard to public health measures, you don't have the right to put other people's lives in danger by not getting vaccinated and by not washing your hands, by not wearing a mask in public. You don't have that right. And people don't understand the difference between the two, license and freedom. They're not the same thing.
And since they don't have that understanding, therefore, then there comes the sanctions and the mandatory making you doing certain things that you wouldn't do without repercussions. So that's why we're here where we are.
I mean, it has been frustrating, because I also believe, I think part of the problem is people hear something and they go, okay, that's it, without realizing that stuff changes. That as medical professionals, as scientists, you're chasing this thing. And so to me, it's sort of the equivalent of, someone tells me, hey, I'm gonna follow you in traffic, and we're going this direction. And then I get mad if you hung a left or hung a right, and I go, well, why did you turn right? And they were going, because idiot, there was a traffic accident up ahead, and I exited the freeway to go around the accident versus sit in traffic. We are so linear. Nope, you told us this, and now you're changing your mind? What's wrong with you? And then folks just put it out on social media, and then people go crazy, as opposed to sitting there going, yeah, guess what? Today, you're gonna have to wear your mask. I know what I said last week, but today is different. To me, got it, because I'm trying to live. I'm not trying to check out early by being a dumbass.
Part of this also, Roland, goes to I think the intentional destruction of science education in the American school system. And the reason that science is so dangerous to despots is because when people think scientifically, they can easily see through your schemes. So if you want to be able to essentially, institute a despotic, anti-democratic society, you don't want your population capable of thinking critically about the facts of various issues, including the facts of nature and medicine. And so this is an example of where that right-wing program of attempting to underdevelop the intellect of the American people has now come back to literally bite us in the behind, because now it's extremely difficult to get across scientific ideas related to the pandemic, related to the evolution of the virus, related to public health policy in a society that has little to no scientific literacy.
Dr. Dan?
Yeah, no, I totally agree. I think I just want to pivot on that issue, but with regards to parents really trying to figure it out for their children this fall, winter. Please make sure you go to www.cdc.gov, look under vaccines, under planning. You'll see all the guidelines. I literally had I moderated a session with the National Council of Negro Women, a great workshop this weekend, but lots of concerns from parents, lots from families, lots from administrators. This stuff is not, it's not easy, but we have to do it. So that whole masking stuff that the AAP, the American Academy of Pediatrics, put out, please follow that. If your constituents aren't, if your leadership in your towns are not following that, figure out how to advocate and work up that chain, because this is serious. We don't have those vaccines for the kids yet. We need to vaccinate them as soon as we get that opportunity, but we don't have that yet. And the time when it's coming, we're not sure. We're saying sometime later in the fall, winter, but by that time, they've already started school. And as I already mentioned previously at the previous discussion here, that we talked about the stats, those cases are rising, they're increasing. While we're not seeing significant hospitalizations in those areas, the hospitalizations are going up, especially in those hot bed areas. Florida, I don't know what they're doing. We didn't talk about it, but DeSantis is tripping over there, and you all need to protect yourselves and be careful.
I do want to have each one of our panelists ask a question, but I just get a kick out of some of these people. I guess this person's name is appropriate. It's Karen. She puts on YouTube, he talking like if people are not vaccinated, they got the cooties or some shit. Oh, well, to each his own. Glad I have my own business. Wow. So now he calling people dumbasses because they don't get vaccinated. Yeah, actually, I am. I'm calling people dumbasses last year who wouldn't wash their damn hands, who wouldn't social distance, who wouldn't wear a mask. And then when the vaccination comes out, then folks say, oh, you know what? I'm not going to take it. Okay, gotcha. But show me all the people who had the same position, like the 34-year-old black dude who's making fun of the vaccination, who's now dead.
Hello.
Or the numerous other people. And here's the deal. You're right. To each his own. But do let me explain something to you. While you're saying to each his own, it's not just each his own. See, this is the difference between, to me, COVID-19 and somebody who chooses to smoke. If you want to smoke 5 packs of cigarettes a day in your house, in your car, that's you. But when I got to deal with your secondhand smoke, you now affecting my life. If you want to drink yourself into a stupor, go right ahead. But when you drink and get behind that wheel, see, then you're impacting me. This is the reality of what's happening with COVID. The people out here who don't want to get vaccinated, who don't want to social distance, who don't want to wear a mask, who don't want to wash their hands, who want to say, hey, I want to live free and be an American. That's why I'm here. It's freedom, freedom, freedom. Well, that's what's causing our problems, because their kids are not vaccinated. They're not taking all the precautions. Their family members are not. And so guess what? This small amount of people is causing the problems.
Vermont. Vermont is the state that leads America. Both of y'all can just correct me if I'm wrong. Vermont has the highest vaccination rate in America.
My understanding, 0 hospitalizations.
Well, I mean, you've said it all, Roland. I mean, but I would say that much of this ignorance is not accidental, that it has been fostered by very powerful interests who like to see the American people suffer. And quite frankly, as I have said on your show many times, all of these unnecessary deaths need to be laid at the feet of the people who created the atmosphere where Americans no longer believe scientific facts, no longer believe medical facts, no longer believe the things that they see with their very eyes. I mean, people on their deathbed saying, I should have taken the vaccine. But there are people who told them that they shouldn't. This morning, I saw a preacher in Tennessee who threatened to throw people out of his church if they got vaccinated or wore a mask. And so, while yes, individuals have responsibility, we also need to be quite aware of the social forces that are at work in this country trying to destroy what is left of American democracy.
Questions from each one of my panelists. I'll start with you, Julian.
Roland, first of all, these doctors are amazing. Thank you for bringing them on and bring their information on. I want to ask both of them, but especially the brother who talked about the resistance to science, the lack of science literacy that exists in our country. So people are saying things like, I don't believe the science. Well, it's not a religion. It's like a fact. So what do you attribute this lack of science literacy to, and what can we do about it?
So there are a couple of things on that. I would say, thank you for that question. So the number one thing is our school system, right? Our education process. It needs to be more rigorous. We need to focus on STEM, science, technology, and math, engineering, all that good stuff to start to address that. But not only that, I think this is what I was going to bring up. Section 230 that has to deal with social media and the regulation around that. Social media platforms are going to need to be regulated. That's just my personal opinion on that. I don't know how other folks feel about it, but the point is, if AI is stupid, and I'm going to say it's stupid, because all it does is give you and feed you what you eat. So if you're looking up some story and it says that this vaccine has this, and all it is a whole bunch of lies sprinkled with a little bit of truth. And people say, oh, well, if it says that there, therefore it must be. The lack of critical thinking is not there. It's just not there. People they don't even know how to go down levels of discernment from first degree. Who's the author? Not every doctor is a doctor. Okay, so this doctor published. Did they publish in that area? Did they publish in this topic? And what does that mean for me? What does that mean for the population? So people have to learn how to verify, how to check information, how to validate it, and actually understand how to discern. Those things are lacking. So critical thinking would be the first thing I would say. And then social media definitely has a part of that, where they're using AI algorithms that aren't really propagating the right message and actually magnifying misinformation.
Yeah, I have to agree with my esteemed colleague. We're in a perfect storm in which two forces come into the American into American culture, going in opposite directions. One is the rise of social media and people's lives being orchestrated by what they hear or listen to on social media, at the same time that an emphasis on critical thinking in education, particularly in public education, K-12, has gone through the bottom. And so these two things coming together is the worst possible set of circumstances in which to have a global pandemic. And so unless we fix this, and again, it comes down to who has the reason, who has a rationale for wanting to fix this. I can tell you that the people who run this country don't have the rationale for wanting to fix this. They want a compliant American consumer who will just buy what they see on their smart television and not really even think about it. That's what they want. That's what they want education to do, is to make you a compliant consumer. If we emphasize an education that provides students with the ability to think critically about the world, they're going to come to the conclusion that the society we live in has to be changed. It has to be changed dramatically. And if the COVID pandemic isn't sign enough, let me be really clear on this. I've been saying the entire time that COVID is a level 3 pathogen. There are much worse pathogens lining up to become global pandemics. And unless we take action now, we could literally be seeing an existential pandemic that threatens the very existence of the human species in a not too distant future.
Makongo, your question.
Yes, my question is also for both of you. I remember when COVID first hit and there was all this conversation about not only the airborne aspect of it, but handshaking and people touching packages and surfaces. With this Delta variant, are these also still areas of how the virus, of how COVID is being transmitted? Should we still be doing things like washing down packages, fist bumps instead of handshakes, those types of things?
So based on the data that's out there, we know that most of the transmission is not really through packaged food and touching certain surfaces. It may be minimal on that, but it's really not the main way of spread. It's really just through the nasal passages and mouth. And so those are the things that are out there. So yes, we should still be washing. Somebody alluded to something about us being dirty and not clean. So wash your hands. If there's one thing we learned from this pandemic, is to be clean. For those who are obsessive compulsive, they're living in heaven right now because they're like, y'all just catching up. Wash your hands, and wash everything else. So yeah, so that's where it's at with that. Make sure you wash your hands, wear your mask, and do all that stuff. It does change, and as I said, science is a dynamic of change. When we get more data, if we find something that this variant does something else, you'll be notified, to be continued. So people can't just stay in one zone. It's literally constantly evolving.
And because it constantly evolves, I would make the point that we should assume that variants will evolve that do a better job of transmitting themselves on surfaces. And so the practices that were just described, which is hand washing, wearing your mask, social distancing, all of those things are going to work without regard to whatever type of variant we're talking about. But we can be sure that new variants will arise with new abilities. And so we should maintain our best practices with regard to preventing the transmission of viruses. And we know how to do that.
Thank you.
Avis.
Dr. Fagbuyi, great to see you here, by the way. Question for you with regards to parents trying to navigate school. A few months ago, I think we all were assuming that by the time this fall came, that children could more safely go back to school and resume a more normal type of educational lifestyle. And now, with the rise of this variant, plus the fact that vaccines have not really been completed, the testing process for the youngest of children, what should parents do in terms of looking out for the safety of their children as they head back to educational institutions?
Well, thank you for that question, Ava. It's great to see you too. Hide your kids, hide your wives, run. I mean, literally, all jokes aside. But I think it's important to understand how this is for families. As I said, I was moderating the National Council of Negro Women workshop, great outreach to the community. Please check in with them. But on the CDC website, I would definitely refer you to that. CDC website, go under vaccine, under COVID-19, or under planning for schools. So it's called SLV, basically school-based planning and vaccination. So it's not only just the COVID vaccinations that will be an issue, but even the regular vaccination that they haven't been getting throughout this whole pandemic. So they're going to be doing that in school. So I want parents to be open to that and to be ready and be prepared that your kids may get vaccinated at school for all their catch-up vaccinations. That's one. Two, I think it's important to make sure they're involved in their PTA, Parent Teachers Association, and in your community response to that. Definitely the masking, work around the community on that. One of the problems that we've had is we've known this for over a year. We had all this time that we know that the distancing within schools, making sure that they have enough funding to be able to construct the school, or at least make it the classrooms in a certain way where it's more palatable and available for them to have more air and things like that. So those are things they should have worked out within their policy. Also, making sure that the teachers, the faculty, staff, all of them are vaccinated. That's also a shield, a layer of protection. That's important, making sure you have hand washing stations or hand sanitizers. All those things are important to be in place, are necessary. I think one of the last things that I think is a problem is with regards to when they're in states, for example, I'm going to use Florida because they're just really doing something really wrong, where they're actually going to penalize schools and school districts with regards to masking, literally fighting them on what we know as life-saving. That's where you have to get involved with the community level, with all the chain of command, meaning you're speaking with your council member, whoever is in power in that city, so you all can advocate for your children. And ultimately, if this is not working out the right way, you may need to take your kids out of school and go to a different district. Literally, some parents are actually considering that in cases where they need to make sure their kids are safe.
Yeah, and one other thing I'll add to that is there has been a concerted effort by the right wing in this country to take over local school boards. And so people who really care about democracy, about preserving our chances to live in a free and equitable society, if you have the capacity, you certainly should, one, find out who's on your local school board and what their politics are. And if you have the capacity, you should consider running and serving on your school boards, because there needs to be a concerted effort to stop the takeover of school boards by right-wing policies in this nation.
All right, folks. Gentlemen, I appreciate it. It's a whole lot to digest there. Hopefully, the folks who are watching and listening really learned something from that. Our goal is to have top black experts on, giving people the information from our perspective so they understand what's going on. And so I certainly appreciate the both of you for coming on to explain all that. Dr. Gray, Dr. Fagbuyi, thanks a lot, gentlemen. Take care.
Appreciate it.
Folks, back to our Roland Mark Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in black-owned businesses, the black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.